Hey guys, okay, so this is gonna be a little bit of a long video because this is going to be a small update after I give you guys the information on the pre-op stuff for the gastric bypass. That is the surgery I've decided to go with after speaking with my doctor, and something that we decided about a month ago. So I've been doing stuff to get everything ready, and now that I've done everything, this is me going to explain to you guys what are the steps that you guys need to take to get this done. Okay, and then afterwards I will give you a small update on how I'm doing and if I have any appointments coming up. Okay, so for those of you who do not know, I suffer from gastroparesis, which pretty much means a paralyzed stomach. I'm not able to digest my food like a normal person would. It actually takes me sometimes hours, days, even weeks. My food just kind of sits there. I throw up a lot. I'm not able to eat anything. So as of right now, I'm on a handy dandy feeding tube. Say hi to Paulette. Yes, Paulette is my IV pole. And pretty much I'm fed 24/7. The only time I unhook is if I got to take a shower or if I'm in a lot of pain and I can't tolerate the feeds, which sometimes happens. I go days sometimes without eating anything. And then I hook back up and slowly start all over again. Okay, so I have decided, or myself and my surgeons have decided, that we're doing the gastric bypass. They feel that this might be the better way to relieve my symptoms. Fingers crossed that it works. It may not. So these are the steps that I had to follow, and anyone deciding to have this surgery will have to follow. Again, it all depends on your surgeon, the hospital you go to, and their program that you have to apply to. Even though I suffer an incurable chronic illness, I still had to go through the regular steps due to my insurance for getting the gastric bypass. I was not able to get it as an emergency, like next day surgery, but I did have it expedited, and I had to do all of my appointments within 2 weeks of getting the package. So for those who will be doing the gastric bypass to help them lose weight, you can actually spread out your appointments, depending also on your insurance, of how many appointments you actually need. For me, I had to do it quickly. So my doctor gave me a packet this thick. As you can tell, it's this thick. This pretty much has, or had, all my referrals, the diet that I have to follow, which is it is called a high protein diet, high protein preoperative diet. Okay, so it states that the purpose of this diet is to decrease the size of your liver. Reducing the size of your liver will decrease risk of liver damage during surgery. Okay, if you have diabetes or kidney disease, please check with your PCP before starting this diet. I did not have to do this diet due to the fact that I'm on a feeding tube. So I did not have to do the diet, but there are people that will have to do the diet. It's this, and then it's clear liquids. Okay, so that's this. Also, you will have to start taking a multivitamin now, and you will be taking a multivitamin for the rest of your life after you have this surgery. I do Centrum vitamins. It's pretty much, it melts on your tongue, or you could chew it. I tend to just suck on it until it melts, and that's pretty much my multivitamin for the day. Okay, so here are the appointments that you have to go through, and excuse me, I will be looking down because I did not memorize a lot of this. Okay, so the first thing that you have to do, which is one of the most important things, you have to get your labs done. Okay, and the labs will consist of a blood test. They will probably take anywhere from 5 to 12 tubes of blood, depending on the test that they need to do. Due to the fact that I'm always in the hospital, my bloods are always drawn, so I didn't have to take that many tubes. but I've heard of people taking actually them taking up to 12 tubes of blood. Okay, you also have to do a urine test. Okay, they want to make sure in this urine test they're screening for any type of drugs, anything that could be in your urine that could be potentially dangerous. So when I say they test for drugs, they can test for pain medication that you're on. They test for cocaine and stuff like that. So they do test all of that. And also you will need a stool sample. The stool sample is pretty much to let them know if you have H. pylori, which is like a bacteria in your stomach, which I've had before. And any other like ulcers or anything that can potentially be harmful to your new pouch. Okay. The next thing is based on your insurance. Depending on your insurance, you will have to do anywhere from 3 to 6 months of weight management. Weight management is when you go to see a nutritionist. They pretty much go over your eating habits, you know, what do you have to change, how you have to eat after surgery, and they weigh you to make sure that you're sticking to what they're telling you to do. Okay? So that's one part of it. Also, the nutritionist can pretty much say whether you are getting your surgery or not. Okay? They can decide to say, oh, you know, this person's not ready and your surgery will be canceled. Okay? The next thing is a psychological assessment. You will have to see a psychiatrist who will evaluate you and make sure that you are mentally able to handle the risks after this surgery, that you're able to handle how hard it's going to be after surgery, because it's not always easy. Okay? They ask you questions anywhere from, do you have support? Who do you live with? Do you have any mental disorders? I do. I suffer from depression and severe depression and severe anxiety. I suffer from panic attacks. So these are things that I had to be honest about and let her know. They are under control somewhat. So I was able to get clearance on that. Another doctor you have to see is a pulmonologist, a pulmonary doctor. To check, they will do a pulmonary function test on your lungs to make sure that you're able to breathe, that you're able to, you know, take in the anesthesia and the air that they're going to pump into your body. You know, they need to make sure that if you have asthma, it's under control. You know, these are things that they're going to check and make sure that are okay. Also, which I didn't know, if you have sleep apnea, which I do, and you have your test results from another clinic, make sure you take it to that appointment. They can clear you for that. If you do not take that result with you, they may make you do another sleep study. So it's good if you take the test results with you. Another doctor I had to see was the cardiologist. I have my own cardiologist, so I just went to him and was able to get the clearance. If you have a cardiologist of your own, make sure you go to them to get the clearance as soon as possible for your surgery. Even if you don't have the surgery date, make sure you do this. Another thing you had to do is a letter of support from your doctor, just pretty much stating that they've been supporting you, you've been their patient, and that they're going to support you after surgery. Okay? For diabetics doing this surgery, you need an endocrinology consult. If you see one already, get it from them. If you do not have one, see if your PCP can give you the clearance. If not, it takes anywhere up to a month to 4 months to book an endocrinology appointment. So be mindful of that. Also, I had to do 2 support groups. And it's pretty much the support groups is just going over certain tips that you can use. My support groups had people who've had the surgery come up and give their testimonials. There was 2 things that I didn't like about the support group. One was that they were only giving positive stories, which is amazing, but I would like negatives also, just to be able to get a clear understanding of the surgery. And also, there was no one who had gastroparesis that's had the surgery there, so that I cannot really relate to. Because again, I'm having this surgery due to the fact that my stomach is paralyzed and I'm not able to eat. So this is another tool they want me to use to pretty much try to help. My gastroparesis will never go away, but hopefully the symptoms can be maintained or monitored and helped, and I can probably eat again. I'm crossing my fingers and hoping that that's what'll be true. That's pretty much all the appointments. Now remember, on top of these appointments, they may not give you the results the same day, so you will have to come back for the results. Okay, so that was pretty much everything, and this is the list that they gave me to go by. They will also give you, every time you go to your weight management classes, they will give you these, which is pretty much like the weight management and how you're going to be able to eat, the foods that you're going to be able to eat after your surgery. So, you know, like proteins that you're able to include, you know, things like that. So this was very helpful for me. Even though I might not be able to eat none of this, it was helpful because it's something that I can start trying out after surgery. Also be mindful that depending on how much weight you are, will depend on how much weight you will lose. My doctor's estimating that within the first 6 months, I will lose anywhere from 80 to 100 pounds. As of right now, I'm 211. So 100 pounds will put me at 111, which is very dangerous. Not too dangerous, but it is dangerous for someone with gastroparesis because we are barely holding in nutrition as it is. So I have to be very mindful of that after surgery. You know, so that's pretty much what it is. Remember, you also have to go on a high protein diet before, which is pretty much just protein shakes, water. You know, you have to eat and drink liquidy stuff. I think it's like a week before surgery, you have to go on a clear liquid diet or a couple of days. And that's something that you want to be mindful of because they're getting you ready for major surgery. You know, they're reducing your pouch. They're actually removing anywhere from 85 to 90% of your stomach. So they're really leaving you with a very small pouch that only holds in about 4 ounces of food. Maybe at a time. It all depends. So, you know, you have to be mindful of what you're putting in your body before then. You definitely want to get your body prepped for the surgery. You don't want to just go crazy eating steak and chicken and all this other stuff because you're like, oh my God, I'll never be able to eat it again, which isn't true. You're just not going to be able to eat crap. Like, you're going to have to stick on a healthy diet. Okay? Now, I know a lot of you are probably asking, why am I having this surgery? You know, a lot of people tell me I look healthy, which is fine. I probably do look healthy to you guys, but my illness is invisible. The only way that you would know that I'm sick is if you look, which I'm going to show you right now. If you look at what my attachment is. So I'm going to show you right now. So this is my feeding tube, my handy dandy feeding tube. I have it really taped down right now because the stitches that I had holding it in, actually they're gone now. They ripped through my skin. So I really don't have them holding it in anymore. So my doctor pretty much told me, please hold it in with tape and magic. And that's what I'm doing. My pain level is at an 8 every single day. Sometimes it actually goes to a 10. Last night I had a really, really horrible night with pain. So I actually didn't fall asleep till about 4:30. And actually woke up when my children had to go to school, which was at 7 a.m. So I really didn't get much sleep. I'm very exhausted. I'm tired. I'm very bloated right now, as you can tell with my stomach being this bloated. This is a lot of the bloat. Also, you guys can tell around my skin. Look, this is pretty much my skin now from me losing the weight. As you can tell, look, it kind of doesn't really go back that well. So these are things that, you know, I'm mindful now as I'm losing weight. See, this is another thing. This is from all the weight that I've lost. You know, I know this is not something people want to see, but this is something that you guys need to be mindful of when you have this surgery. This is all the loose skin that I have in my legs also. I also have in my stomach area, my neck area. As you can tell, I really wish it didn't double up like that, but it does. So it makes me look like a sausage. But this, you know, for me, is hoping to give me at least a little bit more quality of life. It might not work. I'm 100% okay with that. I'm 100% okay that I might be pressing the button to speed up my illness and, you know, speed up whatever it's doing to me. But I'm okay with that because I'm willing to take the risk that needs to be taken. I'm not doing so well, you know. I'm really not doing good at all. That is why I do these videos as natural as I can be. My hair messed up, because you guys need to see the realistic side of this illness. This illness is basically like a life sucker. It really is. I can go out with my family today and it'll take me a week to recover from that one outing that usually is only 2 hours, because I can't be out for a very long time. You know, so that is the reason why I'm having the surgery. And if you're going to have this surgery, please be mindful. Do your research. Make sure you ask questions from your doctors. All of them. All the appointments that you have, make sure that you ask questions. Make sure that you write down your questions and ask them. Make sure that you're keeping track of everything that you've asked, all the answers they've given you, and do your research. Google. If you're in support groups, ask questions. I belong to a gastric bypass group. I ask questions. I belong to a 2B group. I also ask questions to see if anybody's had the bypass in that group. Ask questions. That's like the most important, and I cannot, you know, not specify. Please ask questions. Don't think that any question is stupid. This is your life. You're about to change your world completely by getting this surgery. This is for anybody, not just for people suffering with gastroparesis. This is for anybody. You know, you want to be mindful of what you're doing to yourself, of what surgeries you're having. If you're not okay with having this surgery, say no. You're able to say no. This is your body. This is what they're doing to you. And again, ask questions, you know. So hopefully I was able to give you enough information. If I wasn't, please, please, please comment below. If you like my video, subscribe to my channel. I try to update as much as I can, probably once or twice a month. I'm probably going to do it even more once I have the surgery. And, you know, I will definitely do another video once I have my surgery date, and let you know how that goes. You know, how once I get my surgery date. And, you know, we're all in this together. No one is alone. There are support groups for a reason. Make sure you reach out. Reach out to me if you want to. Reach out to anybody that you think will listen. We are all here. We're all going through the same thing. Just make sure that you ask questions. No question is stupid. Please. You know, be ready for what you're going to be going through, what you're putting your body through. This is for any type of surgery. Please just be aware. Okay? So I hope everybody has a great day. I hope you like my video. I try to answer the questions as best as I could of what you would have to do in your pre-op stuff. If you have any questions, just comment below. If you like my channel, subscribe. Thank you.